So hello everyone and welcome to the webinar, Experiences of Fighting STBBI-related Stigma in African Newcomer Communities. My name is Rachel McLean and I will be your webinar moderator today. Before I hand it over to our presenters from the Sexuality Education Resource Center in Manitoba, I have just a few housekeeping items to go over. This webinar is being offered by the Canadian Public Health Association as part of a webinar series that we'll be hosting over the next several months focused on the reduction of stigma associated with sexually transmitted and bloodborne infections. More information on this webinar series can be found on CPHA's website at the link provided on the screen. You can also connect with me directly if you'd like more information on this webinar series. I'll provide my email address at the end of this webinar. Hopefully you can all hear me through either a headset or the speakers on your computer. If not, your microphone can be enabled by clicking the microphone icon at the top of your screen. It should be green once it's activated. So due to the large number of participants, we've disabled everyone's microphone, with the exception, of course, of the presenters. While we'll certainly have some time at the end of the session for questions, we simply ask that you use the chat box to the right of your screen to pose your questions to today's presenters. And then lastly, before we begin, just a quick note to say that today's session will be recorded and made available on CPHA's YouTube channel in the coming months. In terms of the group chat, your names will be removed from the group chat so that the chat will remain anonymous once we post the recording on our YouTube channel. Today we are going to hear from Simrat, Babu, and Meghali. I'm going to provide you with a brief bio for each of our presenters, and then I'll hand it over to them. Simrat Daniel is the Knowledge into Action Project Coordinator at the Sexuality Education Resource Center in Manitoba. The Knowledge into Action project focuses on working with African newcomer communities around the issues of STBBI, sexually transmitted and bloodborne infections, and stigma and prevention. Simrat is also the Ourselves, Our Daughters project facilitator, where she works through a community-based approach to addressing female genital cutting within the immigrant context in Canada. She is a nurse by training and a community developer at heart. Babu Kinkumba has 10 years of experience working in the social and healthcare field. He immigrated to Canada in 2013 after completing a master's degree in community public health in Belgium. Babu is interested in actions that fight against social inequality. He is a member of the Université de Saint-Boniface research team that focuses on the issues of mental health of Francophone immigrants living in Winnipeg, Manitoba. He joined the Sexuality Education Resource Center as a bilingual community facilitator in 2016. He works on the Knowledge into Action project and also Afro-Franco and OFTA projects. And then lastly, Meghali Sibomana is a mother, student, and employee. She has been working with the Knowledge into Action project since 2012. She has been very involved in various health research organizations as a volunteer. She is also a radio presenter at Radio Réveil, Pause Safari, a talk radio based on cultural diversities in all of life's dimensions. She is a nursing assistant by profession and a radio presenter. Above all, Meghali is a mother of 2 beautiful children and a strong human rights advocate. So with that, I will hand it over to our presenters. As I said, feel free to use the chat function throughout the webinar. You can also connect with me directly or use the chat function if you're experiencing any technical issues throughout the course of the webinar.
Hello, are you hearing us? Hello, are you hearing us?
Hi, Simrat. Yes, Simrat, I can hear you clearly. And if anyone's having any issues with audio, they can connect with me directly. So over to you.
Okay. Uh, Before Bau's presentation, first I want to say welcome to all participants in this webinar. Uh, we sent you an email yesterday regarding our pre-session evaluation survey. Some of you might have already responded to the survey, but some do not. So can you please kindly go to this survey and fill your response. It might take you about 2 minutes. And thank you.
Thank you, Rachel. Should we give a minute or we should start?
I think we can give a minute for folks to just to fill out that pre-evaluation questionnaire. If you're having trouble hearing, if you can try to put your volume all the way up, and I'll also just ask our presenters to speak as loud as possible.
So thank you, everyone. Thank you, Rachel. I think we will start now. Welcome to our webinar, experiences of stigma, of fighting stigma, STBBI stigma, please, in African newcomer community. For folks who may not know about CIRC, I will start by saying that CIRC is a community-based pro-choice organization that promotes sexual health through education with a vision of a diverse society that celebrates sexuality throughout life. We are in Manitoba. We have office in Winnipeg and in Brandon. The objective of our presentation today is practically sharing our learnings about stigma related to STBBI from the community we are working with, and also see through the same learnings the strategies and tools that can help to reduce stigma in the community. In this project, to begin, we work with a community, African newcomer community, and the project is called KIA. This community, we will talk a little bit about them in a few minutes. And in our model of reaching the community, we engage the leaders, which are official and unofficial leaders. We work with them, we do some series of workshops, and from the leaders, we can't gain an easy access to reach the community because this community trusts and hear their leaders. So, and we engage them in all steps of our activity. We organize workshop with a community group. We also have community resource people who are community connectors. They are trusted, and some of them speak one or more community dialects, and they help their fellow community members by interpreting when they're accessing services. We also work with service provider, as we are doing now. We are sharing our learning, and also we learn from you guys. In this work, we use a collaborative approach. We reach local ethnocultural and community organizations. We engage key individuals from diverse community. As I mentioned, the leaders who are official leaders and unofficial community leaders. Some of them are infected or affected by STBBI or HIV. Some of these are also key advisors to KIA projects. We connect or we partner with local and national service provider. We take part in a knowledge exchange, and we evaluate also our work, what we do every time with our evaluator. To talk a little bit about the community we are working with, the African community we work with is an heterogeneous community in terms of languages, beliefs, immigration stream. Some identify many African countries as their country of origin, for they lived in those countries prior moving to Canada. Some have a bit knowledge about STBBI, and others are unaware about STBBI information. Some knew their HIV positive status prior coming to Canada, and others were diagnosed after arriving in Canada, but all of them are under HIV treatment. Marital status, some are single, married, some live in a discordant relationship. So to share some of our experiences and learnings in working with this community, when we are addressing the topic of STBBI with these people, they really show fear to come into contact with legal issues and deportation or situation that may influence their immigration status as a asylum seeker or as a refugee. As we know, in Canada, all immigrants and refugees must submit to a mandatory medical examination policy that includes an HIV test as part of their immigration process. Although refugees who are tested positive can come to the country, still this policy has really consequences on people's life and make HIV prevention more complicated. For our experiences on the ground, this creates a perception that all Canadians are tested for HIV and that there is a tight control over the infection. Most people think that only a category of people may have HIV. For example, a community leaders workshop member participants say this, that at the end of our session, he said that STBBI can infect a person like I and him, not only prostitute, is a helpful knowledge for us. Some also, in addition to what I've said already, they don't see big sign on the streets. They don't hear major campaign against STBBI HIV, so they perceive that there is no HIV in Canada. As one of our community workshop participants say at the end of our session, before people thought that there was no HIV in Canada. Now we know that is not true. So we can see that there is a shift in the perception. Often we hear participants shift their perception, but they are also mostly express their day-to-day frustration and experience of stigma. So I let my colleagues Simret and Magali talk a little bit more about it.
Simret and Magali, we've had a few participants express that they're having trouble hearing, so if you could just speak as loud as possible, that would be great. Thank you.
Okay, thank you. Thank you, Babu. So before I talk about what stigma is and our project learnings on the next slide, let's talk about these two questions. For each question, choose what you think is the best answer, and we will look at the response posts together. So, thank you for your response. Then now we go to the second question. Okay, thank you for your responses again. And as you can see, like the percentile of responses, um, if we had discussion close to the end of our presentation, some of your response for some it might be a bit different. So I wanted to start by defining what is stigma. Stigma is a perceived negative attribute that causes someone to devalue or think less of a whole person. It is a negative and stereotypical thoughts, attitudes, feelings, people may hold about another individual or community on the basis of specific qualities like race, immigration status, sexual orientation, gender, culture, health, and religion. Stigma labels certain individuals or groups as less worthy of respect than others. These attitudes are spread by ignorance, prejudice, and discrimination. They are perpetuated when a community is represented in a way that is inaccurate or non-scientific by the media, in popular culture, or informal institutions like legal system. When there is STBBI stigma, people fear to engage in an informative discussion, access testing, treatment, and harm reduction services. For example, when we hold workshops with communities, especially on our first workshop, we usually get a question: where does HIV come from? What is your view on this point? We tell them that we are there to focus on HIV information sharing without discrimination. At times, we get stuck on similar questions, as the communities are very unhappy by the ways Africans and African immigrants seen as a source of illness and primitive. One day, one of the elder participants said to the group, "We understand what you are saying, but you are also seeing this facilitator's approach. So let's proceed, please. By the way, if there is a poisonous snake lying around where you are, would you focus on how to protect yourself from getting hurt, or would you try to explore where does this snake come from, or what are others saying about?" We hear lots of STBBIs and other intersecting issues related to stigma, in particular HIV-related stigma experiences from our participants. It can be isolating an African Canadian in airport or healthcare settings because they showed signs of cold or malaria, but misdiagnosed as Ebola or hepatitis B, or others of, layers of stigma like racism, poverty, HIV-related stigma, discrimination are some of the issues that we hear from our participants. As also we know, HIV non-disclosure has been criminalized in Canada, which affects racialized communities significantly. We also have seen how Black men are framed negatively by the media. It also affects women negatively. Most of our project participants who are living with HIV tell us they involuntarily abstain from sex or sexual activity. The law is not helpful. One of the immigrant women says, "For me, it is kind of frustrating and very unfair, in particular, the law on disclosure. Okay, you are sick and you have to tell, but again, what are the measures put in place to support disclosure? All this is telling you that you are a criminal. You are criminalizing HIV and sex." When we discuss with communities, we mostly hear that silence is the safest. The way one of our youth workshop participants said, To me, silence is safer. For many people as well. Better not to go for a test or talk about the big elephant in the room, HIV. We all know that discrimination does what does to people or a person. Um, so when we have frequent conversations of stigma from the community and the immigrant women living with HIV, this group of women living with HIV inspired a process of community-based research between 2015 to 2016. The community-based research project was done with this group of women that Babu was mentioning, living with HIV, who met regularly at CERC to explore the experiences of care and support of African immigrant women living with HIV, to mobilize knowledge that may lead to fostering positive changes in care and support for immigrants, especially also immigrant women living with HIV. You can go to our website and find African immigrant women living with HIV CVR project report. For now, I will mention a few points only on the layered stigma the women face and unnecessary disclosure and its impact on women's life. We will also focus on personal and institutional stigma by service providers. To mention one of the main layered stigma and discrimination, some of the women face discrimination when they are looking for a safe housing access. Here, like one of the women says, but it was not easy. When it came to look for a house, the person in charge of housing kept on taking me downtown. I looked around, and it is not safe place for my kids. And I only had 3 chances. They said that's it. We cannot get you another house. She was looking for a home, not just a house. She was looking for a safe place close to her church where she gets her main social and spiritual support, especially when she doesn't feel well. They provide a very good care for her kids. But the service provider showed her houses only in downtown area, and she lost her only 3 chances. And the lack of understanding on how HIV is transmitted affects individuals and creates an environment where those living with HIV/AIDS are unjustly targeted. This has caused many people to suffer consequences after disclosing their status, or prevented many people from disclosing their status for fear of discrimination that will follow. Some of the women also shared with us about their HIV disclosure when accessing service and experiences of discrimination for disclosing their status to their future employer, current employer, social support case manager, and others. However, some lost job without clear reason or explanation provided. Some also discriminated because of the service provider's breach of confidentiality or disclosure of HIV status to other staff who provide care. In the moment, it was not necessary to be disclosed, as the staff have to follow universal precautions of preventing infection while providing client-centered service. Like one describes it as, I don't know why they do that. Like she mean like tell the workers of her HIV status, I'm scared. She did not cook for me, did not clean the house, just sit on the couch. They do not come to do what they were supposed to. One even used gloves around. She did not want to come near me, and I mentioned to her that was not right. So I think Megali will explain more about the unnecessary disclosure and unintended consequences um, in the following slide after showing the video on after seeing the video facing stigma in our own words video shortly. Rachel?
All right, so I'm going to play the video. If anyone has any issues seeing or hearing the video, you can just let me know through the chat function.
My name is Bose. I'm an immigrant from Africa that lives with HIV. Before I moved to Canada, I was expecting more welcoming environment, people who understood more, kind of zero stigma, no judgment.
When I come to this country, my expectations were like, there is fairness, there is a straight line, but I was very disappointed. It's like, you have a paint on your face, I'm HIV positive. Within even my community here, a woman is being looked at as a bad guy. They think the only way to contract it is through prostitution. So there is name calling.
I completely avoid being with my community because of stigma.
Oftentimes, when people hear about hospitals, clinic, doctors, what comes in their mind is a safe place. Your health is in their hand, but it's different.
My first child, I have C-section. I need home support. I call the family service. I am just honest. I just say, yeah, I have HIV. And okay, I will send you somebody. And then first, she didn't tell me she used gloves. After that, I lose my confidence. My second child I have, I don't know who's gonna show up again and hurt me. I don't wanna, I need help, but I don't.
ድሕሪ ኦፕሬሽን ምግባረይ ናብ ትራንዚት ከይደ ኣገልግሎት ንኽወሃበኒ ቀረባ ቤተሰበይ ከዓ ክትርጉመለይ ሒዘዮ ዝኸድኩ ንሳ ከዓ እትወስዶ መድሃኒት እንታይ እዩ መድሃኒት ኢላ ምስ ሓተተትኒ ኣነ ከዓ መድሃኒት እዩ ኢላ እታ ኢላ ኣትሪራ ምስ ሓተተትኒ እቲ ናይ መድሃኒት ከዓ ኣነ ከዓ ናይ HIV ምዃኑ ነጊረያ እቲ ቀረባ ቤተሰበይ ክትርጉመለይ ሒዘዮ ዝኸድኩ ሰንቢዱን በኺን ንኽነግሮውን ቅርብቲ ነበርኩን ብድሕሪኡ እቲ ገልግሎት እውን ኣይተዋሃበንን.
It's really trouble. And people who never went to school, people can write and read. People are given long papers to sign. Don't even have time to go through some of the things. Sometimes you're even signing off your life. When things have gone wrong, that's when they tell you, oh, but you signed. I signed, I never understood.
muri icyo gihe rero navuga yuko ntabwo byanyoroheye nagize intuntu nyinshi cyane bamaze kuntwara abana aho rero naciye nitegereza nti none abana ko tumaze kuyoberanwa nkaba mbona muri iki gihugu ikintu gifitiye akamaro abantu ni icongereza udafite icongereza umva jewe sinzi icongereza sinzi no gusoma sinzi no kwandika kugeza ubu naho CFS yobansubiza vyomera bite ko twamaze kuyoberanwa mu rurimi no bafasha nte.
There are so many things that have to be put together in order for the medication to work. Yes, I do need my medication. I do need health services, but I also need compassion. And if you take the medication and there is also that love, it will make it much better.
The group has helped me in a lot of ways. One was, it's like my family here.
Being together, people living with HIV, where you feel you are in a safe place. Having a safe place, it's a big deal. It just feels great to see that somebody will look at you the way you are. If people could look at HIV people in that way, it will make a big difference. People will be more open to talk about their statuses. And when people are open, maybe we'll have few cases of HIV. We all need to work together.
Thank you very much for listening or watching the video. So that was the video that was produced by the African immigrant women, and that was because they wanted to express, to show what stigma meant for them. And as we all know, stigmatization is known as a negative thing, but we don't know how each one of us experience it. We do experience it in different way, and for these women living with HIV, for them stigmatization, it means shame. It means a disgrace. It means being reminded every day of how useless your life is. And most of these women, they said, you know what? I feel like I'm stripped of my confidence, my self-esteem. I have no passion. I have no motivation. Why? Because when I go to the hospital, a place where I'm supposed to be feeling safe, I am obligated to disclose my HIV status in front of a healthcare provider who is supposed to be knowledgeable on what disclosure means. I am escorted by an interpreter because I cannot speak the language, but I'm so obligated to say my HIV, even though when the healthcare provider sees my chart and see that I'm HIV positive, they still ask me, do you know what medication you are on? Do you know what they're for? And I have no other choice than saying my status. These women, they feel like they have no place. Safety is a very big deal for them, as you will notice in the video. One of them said, before coming in this country, I thought there was fairness, but I was very much disappointed. Why did the lady say that? Because she had the perception that she's going in this great country where people are open-minded, where people are knowledgeable, where she will feel more safe than where she was. But when she got here, she realized it was worse. Everywhere you go, as soon as you say you're HIV positive, there is that facial or corporal expression of like, oh, really, ew, and some of them, they decide not to talk about it. Why? Because it's safer keeping quiet than saying who you are or what you are. Some of them, they're mothers, widows, married, and they live with their families and children, but they cannot disclose. Why? Because they are afraid of being alienated. They are so much afraid of losing the affection that they have from their relatives, their children. They are obligated to live with secrecy, and it is such a heavy burden for them, because one day their children or maybe their family will come to know about it, and the reaction might be different. They know that there might be two possibilities: either they embrace the truth or maybe they get rejected. But how do I do that? How do I disclose? One lady said, I no longer go for dates. I would rather stay single. And we asked why. And she said, I was chatting with this guy for a couple of months, and we decided to meet. He was from a background different from mine, and as soon as we met, we were having coffee. He asked me, "Are you clean?" I was so excited. I said, "Oh yes, I am clean. I don't do drugs." And the person said, "No, I meant, are you HIV free?" Before she could disclose, or before she could even go into that conversation of HIV, the person looked at her race. The person asked her where she came from, her home country, and concluded that this person might be HIV positive. Is that what safety is? Is that how things are supposed to be? It is very difficult to disclose. And if we don't disclose, we are not helping. If there is no openness of disclosure, it's going to be very difficult for people to come up. If we're to reflect on how we as individuals, or maybe our institution, can contribute toward HIV-related stigma reduction, how can we do that? You who is following us, reading, and people who will read us, how can we make a positive impact towards HIV-related stigma reduction? I think I will really suggest, I invite all of you to really comment, say what you think on the best way on how we can go about contributing toward HIV-related stigma reduction, because we really do need something. Something has to be done. And whatever you think it is, it doesn't matter. There is no restriction, there is no boundary. Just say what is on your mind, because whatever comments you do provide, it's helpful. It's a contribution to a better tomorrow, which is in our society. And having said that, there are so many recommendations that we have in mind. How do we address stigma and discrimination in our communities at large? You as an individual, if you're a parent, is it easy for you to talk to your children about HIV? We do know that knowledge is power. You don't want to be ignorant, because once you are ignorant, you're a fool, if I may say that. You know nothing. How comfortable are you talking to your children, to your siblings, to your coworkers about HIV? Another thing is, we're all human. This country is such a great country. We believe in equality. We believe in the human rights. How about HIV people? Do you think that there are people who deserve to have more rights than others just because they are HIV? Can't we talk about it like the same way we talk about any other diseases, like cancer, like malaria, like MS? Let's talk about HIV on the table and not under the table. Thank you so very much for everybody who is commenting. We can read your comment. They're fantastic. Thank you so very much. We will continue with our recommendation. And one big key among our recommendation list is the policy development and the implementation in workplaces. It's really very unfortunate and sad when these women living with HIV, they have to really try to go look for a job. And when they are handed the form, fill in whatever you have to fill in. And what we have to understand is that these women, they don't have a high level of education. So their qualification may not be as required by some employers. And sometimes they do not understand their rights. Some of the forms, they will say, okay, do you have anything that may restrain you from working, like health issue or whatever? And innocently, or maybe honestly, they will write down, I'm HIV positive. Do they have to do that? No, but they are not knowledgeable in what is their rights. And as soon as the recruiter sees HIV, there is a difference facial expression. Most of them, they are denied jobs. Is that fair? So some policymakers, they're supposed to really review the way they do hire, the way they implement their policies. And finally, another big key to our recommendation is to all the healthcare providers, there has to be more refreshing training. It is very sad when you're a health provider, you're taking care of an HIV patient and you're double gloving. It's very wrong. When you have to put on double glove just because you're attending to a patient who is HIV positive, that does not show compassion. Instead of that person getting better, they will get more sick because they will feel like they are not welcomed. They will not feel safe. We all know that for an HIV person and any other person who is suffering from one sickness or another, in order for you to be holistically okay, you have to be okay in all the dimensions of your life. So we really have to work together. We have to work very hard. And if we show love, if we show compassion, if we show care to people living with HIV, it will help people coming out and disclosing, and our children, they will be able to live in a society which is free, which is safe. We will not be afraid of who is sitting next to me, who I am talking to, who I'm working with, and it's gonna be a better society. So those are some of the recommendations that we came across, and we are inviting you, if you have some more recommendation, please do write to us. The law, it's a big deal. It's really a big deal. These African immigrant women living with HIV, every time we talk with them, there is the word law that keeps coming. They will say, it is true that I am supposed to disclose if my CD4 count isn't that good, if I'm at a risk to infect the other person. But also, it is also said, if I have a higher CD4, I don't have to, as long as I wear condoms. But they forget that there is an issue with trust. I may get a partner who is not HIV, and I am HIV, and I disclose to them, we protect each other, and somehow the person goes and have sex with somebody else, and then they get infected, and they will pin it on me. The law doesn't look at me as a person who is genuine, who did her right. They look at me as a bad guy. So these women, they're really very concerned about the law. There should be some changes in the law. It has to be fair. There shouldn't be like one party which is higher than the other one. In order to have a huge turn up of disclosure, there has to be fairness in the legal system. We thank you so very much for listening, and just a reminder of the people who are part of this Action Care project. Simret Daniel, you can see the email address and the phone number, and Babu, and myself, Magali. In case you have more questioning, in case you have some more feedback, feel free to email us or maybe give us a phone call. Why not? We'll have feedbacks. Yeah, thank you very much. I will be, there will be, I'm not sure if there are questions or comments. Rachel?
Thank you. Yeah, thank you, Simrat, Babu, and Megali for that very informative presentation. Certainly lots to think about in terms of stigma and how to reduce stigma within our work. So at this time, I'm going to invite everyone to pose their questions using the chat box. As we mentioned, all of the microphones for the participants are disabled, so You can use the chat box though to connect with our presenters. I'm just going to move it up a slide. So as you're taking some time to pose your questions in the chat box, I just want to flag that our presenters do have a post-session evaluation survey. So the link is there. It shouldn't take you more than a minute or two to complete, and it's just to help them get a better sense of how the information that they presented contributed to your learning around issues related to HIV stigma. So we'll wait. Sorry, go ahead, Tamara. We'll wait a few minutes as some questions are coming in through the chat box.
And just to add to Rachel's point, also like the questions are the same as a pre-session evaluation questions, but we need to compare the pre and post evaluation responses. Thank you.
So I think as some of you are thinking about your questions or as you're typing in the chat box, I'll start with the first few that have come in. So we have a question from Jenny, and the question is, how can we address this health issue without increasing stigma? So I'll turn it over to you, Simrat Babu and Megali.
I think the best way to address this without increasing stigma, it depends on how we look at the stigma. In everything, there has to be something good and bad, and oftentimes there has to be sacrifices. The truth has to be said. What is HIV? How do people contact HIV? However, the best way to do that is through education. We have to educate people. We have to go to communities and do some engagement, do some activities, talk to people. Like, it's okay for people to know what is HIV and the stigma, how it affects people, and that will help the community to know how to protect themselves and how to also protect those who are living with HIV by showing them love, understanding, and compassion. And doing also a lot of like testing too through the education. It's very important, you know.
Just to add to what Magali has said, I can answer that question by saying, as a service provider, we should not be ethnocentrist, so we should look how we can break that ethnocentrism, and also we can make our service be flexible because we have different value and culture. So if we can try also to adapt our services the way we are delivering, so it may help somehow to pass out of stigmatize our client or our patient. Thank you.
Thanks, Megali and Babu. We have another question from Félicien. So where or what is the role of politicians?
I think I would say like HIV stigma has to be addressed at every level, micro and macro level, because stigma is affecting a person, a community, people. So it is a real issue. As it is a real issue, so everybody has to be involved, it can be like in different aspects. It can be like it can be like around developing policies or funding different projects or disseminating ways of disseminating informations. It can be in different ways, but unless politicians are involved in reducing stigma, like we are just trying to work with just one hand, because like everybody has to be involved for real change to happen, because a person, a community, a person and a community and people are really affected by stigma, and it the prevention is also affected. So HIV infection also will keep like spreading. So it is one way of also ending HIV or reducing HIV.
To add also on what Simrat said, like when it comes to politicians, the biggest recommendation will be like for them to get involved. And what do I mean? Like most of our women, they talk about the legal system, and people living with HIV, it will take them probably forever to just express their feelings, their mind. But if there is a politician who takes the issue at hand, he has or she has more say or maybe more voice to reach out to those who make the law. And yes, HIV can affect everybody and anybody. It has no limitation. And I'm very sure there are also some politicians who are HIV positive. It's when you put something as your own, as maybe something that affects your loved one, you will know what to do. We need people to talk about it without any borders. Thank you.
Thanks, Simran and Megali. And just to say that Félicien added a follow-up note that politicians should be invited to forums such as this one, and certainly make sure they have information to the great information you presented today. We have another question from Amanda, and the question is, what are certain words or phrases that we should avoid saying when asking if someone has HIV to prevent that individual from feeling targeted, judged, or stigmatized?
So some of the words and phrases, okay, that could avoid that can help preventing judgment.
It's a very tricky question for now, because like we haven't tackled that for sure. But however, there is an example that one of our women gave is she was rushed to the emergency, and she was alert and oriented, though in pain, and beside her there was a neighbor who had gone with her. So the nurse who attended to her first at the emergency asked her for the health card, and she gave it to the nurse. And later on, the nurse was asking her, do you know if you're on any medication? And the lady was like, I do know. Do you know what those medications are for? And the lady was like, yes, I do know. And the nurse was like, can you tell me what they're for? And the lady was like, you know what they're for. I don't have to say it here. And the nurse kept on insisting. So I feel like it's gonna be up to the healthcare providers and maybe the social workers and us as a group who is working with African immigrant women living with HIV to come up with some phrases. Maybe get back to them and say, what would you like us or people not to say that will make you feel offended? And once we get the feedback, maybe we can put it. We will put it on our website, on our posts and evaluations. I'm not sure if that's the best response for now, but yeah.
Thank you. Yeah. And also, like I would add also to Megali's point, also the person who is living with HIV, is just a person who is infected with HIV. But we should not address a person like as HIV, because the person is more than HIV. But like any other infections, also the person is like infected with HIV. So and also we have to be also culture inclusive, and it is the best way to be far away from judgment. Also, I think we have to be open to assess our biases, and also at the same time also to ask the person how do they want to be treated, how do they want to be addressed, how do they the easier way is to ask the person who is affected or infected. That makes it more easier to use respectful and meaningful words for when we are talking with a person, or phrases when we are talking with a person.
To add to what my colleague had just said is, as a service provider, for sure, we are different service provider. We work in different tasks. But do we also have to know our status for our clients? It depends on where you are working, because there are some service providers, knowing the status of the patient is not really important to the service that they want to provide. So in that kind of case, why do you want to ask the person about his status? And also, as a service provider, we have to check in with our patient. We have to talk about them, what they want to talk and what they will not have to talk. So we just have to come and ask them, what is your status? So if the person come to see you for your services, check first what he come to seek and ask him what he feel comfortable to talk with you. And as a professional also, we have a professional obligation. In my work, for example, if you don't have to know the status of the patient, why should you ask him to tell him his status? So there is things that we can do and we can avoid through our professional obligation. So that's what I can say.
All right, thank you. So I think we'll just we'll end with one final question. We have a comment and a question from Joanne. So the comment is, thank you for your presentation and sharing your experiences working with African communities in Manitoba. And then the question is, if possible, please could you speak to the experiences of newcomer African men around stigma and HIV? It is important to avoid the feminization of HIV. And then could you speak to the work being done around community level stigma?
Thank you for the question. Yes, we also engage communities and community leaders. Some of them are affected or infected with HIV. Some are also not. So, but in terms of like deep community-based research, because of funding and other situations, we're not able to do like a deep research, but in our workshops and sessions also, always we learn new things, always we learn new experience and information. And like really, like black men are like, especially when we see the law and the media how frames black men, also like always in our sessions, like it come like almost in everyday discussions. And like participants, like when they come first, especially if they don't know us, or if they are new to CERC, they try to go very carefully and slowly. When they come to the session, we can see the fear associated with law and immigration status, all the intersectional issues and stigma that comes up with HIV. So yes, that is important point also to address and bring. If we had time, we would have talked, in fact, more about leaders, youth, and I hope we get another chance to talk also in a more detailed way.
I'm gonna quickly add something. Yes, that's a very good point. Like from time to time, we do meet with our sister group, the fire sister group, right? Just to have different perception, different understanding, and there is always that comment of like, oh, your black men, they infected us with HIV. So there is a lot of blames, and sometimes like when the men come to our training, our workshop, they are very quiet, and when you ask them why you're so quiet, they will be like, besides, this country favors more the women, at the end of the day we're being looked at as bad people, so we don't want to venture into that. It's a very good idea to research, to find out on the way the black immigrant men are being affected with stigma, and if we are able to do that, it will give us a good view, a good level on knowing on how to move forward, on how to be of better help to everybody.
All right, so I think with that, just in the interest of time, we'll wrap up. Thanks again to Simrat, Babu, and Megali for your very informative presentation. There's lots of comments coming in, so feel free. All of our presenters will have a chance to read your comments, and you can definitely connect with them directly if you have any other questions. Before we close, I just want to say that we are having another webinar on December 5th. The webinar is the Social Organization of Perinatal Care for Mothers Living with HIV in Canada, Revealing Promising Practices. So if you're interested in that webinar and hearing about how we can improve prenatal and postnatal care for women living with HIV, please do register. You can register at the link on your screen. And then lastly, there is an evaluation survey that will open up once you exit this platform. We ask that you complete that. It just will help us improve our future webinars. As I said, the recording will be put on CPHA's YouTube channel. And to learn more about our webinar series and the various topics that will be covered over the next few months, please, you can access the link on the slide there. You can find out more information about our webinar series and also more information about some of CPHA's resources around STBBIs and stigma reduction. And then lastly, my email is on the screen, so please connect with me if you have a question about the webinar series or about some of the information that was presented today, and I can make sure that I forward your question or your comment to Simrat, Babu, and Meghali. So with that, thank you everyone for participating. We really appreciate you taking an hour out of your busy day, and with that, have a great day.